Benchmark Policy Brief. Climate change is an emerging yet prevalent public health issue. The American Public Health Association reports that climate change has led to increased heat waves, extreme weather, the spread of insect-borne diseases, and worsening air pollution at the top. The health effects of climate change include heart and respiratory complications, pest-related complications such as Lyme disease and West Nile virus, food and water-related illnesses, and injuries and death. Human-caused climate change affects American society's health, safety, and well-being, with future detrimental health outcomes dire without immediate action to remedy the problem. Climate change-caused health crises present major public health opportunities. Strategies such as creating healthy energy, transportation, agricultural systems, and land use will have immediate and sustained health benefits to curb future health concerns posed by climate change. This paper discusses climate change as an emerging and prevalent public health issue, how current policies address it, proposes changes to existing policies by relevant stakeholders, and its impacts on the healthcare delivery system. Public health issue. Climate change caused by air pollution has detrimental effects on public health within the United States and globally. The executive director of the American Public Health Association claims that all Americans should comprehend the effects of climate change on health and treat the problem as an emergency that needs immediate action. Human activities such as agriculture, transportation, and industrialization have resulted in air pollution by releasing solid, liquid, and gaseous substances from factories, motor vehicles, or wildfires. The environmental problem poses immense public health issues, with respiratory health being one of the major problems. Air pollution increases the risk factors for asthma and chronic obstructive disease after exposure. The symptoms of the respiratory disease range from acute/reversible decrement of pulmonary function, bronchial hyperactivity, airway inflammation, cough, phlegm, and wheezing. Long-term exposure to air pollutants results in acute to chronic illnesses such as COPD, lung cancers, and cardiovascular diseases. Air pollution occurs at local, state, national, and even global levels. Most air pollutants persist in the atmosphere, and winds carry them over long distances transcending local, regional, and continent to impact global weather and climate. For instance, the depletion of the ozone layer is a global health threat from air pollution that exposes people to harmful UV rays, increasing the risks of unwanted body mutations and cancers. Rao, 2020. Subsequently, air pollution is catastrophic for everyone in the US and globally. The more an individual is exposed to the pollutants, the higher the risk of acquiring respiratory diseases, such as coal workers in the mining industry. However, air pollution has a detrimental impact on pregnant women, infants, and children, the elderly, persons with chronic conditions, and low-income communities that lack access to quality care. Current policies. The United States has policies that protect public health. The United States Environmental Protection Agency, EPA, sets laws and regulations to curb air pollution. Through the Clean Air Act, CAA, the EPA regulates the limits of air pollutants released, EPA, 2023. The agency also regulates the emissions of air pollutants from steel mills, utilities, and chemical plants. Besides the CAA, the United States also establishes air standards to improve public health safety. For instance, the National Emission Standards for Hazardous Air Pollutants, NESHAPs, determine the specific regulatory limits for sources that release radionuclides. The National Ambient Air Quality Standards, NAQS, also aid in regulating outdoor air pollutants harmful to public health and the environment, EPA, 2023. Therefore, the United States Environmental Protection Agency, EPA, has set primary and secondary quality air standards for carbon monoxide, lead, nitrogen dioxide, sulfur dioxide, and particulate matter. Changes to current policies and steps to initiate. The United States has safe climate goals that demonstrate significant health benefits. One of the main changes to improve existing policies is incorporating health equity as central climate action. Climate change caused by air pollution affects all American, but some people are more prone than others. Climate change exacerbates health disparities and harms vulnerable individuals disproportionately. Low-income communities, children, pregnant women, elderly persons, those with a disability, people of color, indigenous ethnic races, and outdoor workers are highly predisposed to air pollution. Climate Health Action, 2019. Meeting and strengthening the U.S. commitments under the Paris Agreement will reduce climate change. Rapid reduction in carbon emissions will be essential for public health in the future. The U.S. should recommit to the Paris Agreement to limit the global temperature rise. Climate Health Action, 2019. The U.S. should also ratify and implement the Kigali Amendment to curb hydrofluorocarbons use. The policy change will improve public health and safety. The first step towards policy change entails identifying the problem. The stakeholders should collect and summarize data on public health concerns raised by air pollution. They should package the problem as a potential policy solution. Secondly, the stakeholders should conduct a policy analysis to determine how it will solve the identified problems. The policy then undergoes the legal process before it is enacted and implemented. Finally, the policy developers monitor and evaluate that policy to make recommendations for improvement. Stakeholders required for policy change. The government, civil society, business leaders, candidates for office, and elected officials should be aware of the health threats posed by climate change. They should know climate change is a health emergency and collaborate with government agencies, such as EPA and communities to act on the Health and Equity Policy Action Agenda. Climate Health Action, 2019. Public health nurses and other healthcare providers are instrumental stakeholders that identify public health concerns, create intervention strategies and propose policies to promote public health, safety, and well-being. The government allocates funds and budgets for the resources required to promote public health safety. Communities protect the environment through proper land use and agricultural activities. Impact of healthcare delivery system. Air pollution linked to climate change negatively affects people's health globally. Air pollution predisposes people to respiratory diseases, while long-term exposure can lead to chronic health conditions. Thus, air pollution doubles the demand for healthcare services from exposed individuals. High morbidity rates lead to high hospitalization rates that are costly for the patients, healthcare facilities, and the government, and increased demand for healthcare. Wang, 2020. Increased costs for healthcare services make quality care unaffordable, leading to ill health communities. High demand for healthcare services may also overwhelm the healthcare workforce, leading to increased chances for burnout and work-related stress. Burnouts among healthcare providers reduce productivity and performance, reducing the quality of care and patient safety. Conclusion. The current climate change has become a global health emergency, resulting from heat waves, extreme weather, the spread of insect-borne diseases, and worsening air pollution. The United States has declared that climate change is one of the greatest threats to Americans' health. Air pollution is a public health issue, with respiratory health problems as one of the major health concerns. However, collaboration among relevant stakeholders and policies will improve public health safety and well-being. Addressing potential health disparities will improve healthcare delivery among the highly predisposed people in the community.